balance is an important part of everyday life, right? From breakfast to work to family.
So it should be no surprise it is also crucial when it comes to exercise. But it's very easy to have a muscular imbalance, and that can lead to injury. Sarah is going to keep us injury-free with a look at some ways we can fix the problem.
That's right, guys. Steve and Allison, a lot of us, want to work out. We have all these little pains and aches and things that we think are normal, but my guest with me here today tells me that may not be so normal. Chris Estafanous, the director of Sports Rehabilitation at Set Sports Physical Therapy, is in to talk with us a little bit more about this. Thank you for coming in.
Thank you for having me.
Give me an idea. What are we talking about here? What kind of muscle imbalances, and how are they really, I guess, having a detrimental effect on our workouts?
So if you were to walk around the streets and you were to look at people, a lot of times you find people walking around forward head, rounded shoulders. And what that correlates in day-to-day life is when you're sitting at a desk for a prolonged period of time, your anterior muscles, which are your pecs, end up getting really tight and shortened, and the muscles of the back posteriorly end up getting elongated, which ends up making them weak and inhibited.
And that's the case for men and women in general.
Absolutely.
But you say there are some imbalances that are specific to women and specific to men. Tell me a little bit about
Absolutely. For
that.
example, women wear high heels.
I took mine off just because I knew you were doing.
I checked them out before.
I know you did.
What happens is women, for example, when they wear high heels, their gastrocs get really shortened.
Their calf muscles.
Yeah, their calf muscles get really shortened, then they end up in a shortened position, and when they go to, walk in regular sneakers, they feel the difference from, wearing heels and then going into sneakers later on in the day. So what that happens is when they go, for example, for a run and they're wearing flats as opposed to heels, the calves are already tight, and that what can occur with that is Achilles tendon injuries, knee injuries, hamstring injuries, because the body's compensating to try to correct those.
What about men, real quick?
Men, for example, oftentimes they carry briefcases in one hand, and then what you'll see is a lot of people are side bent, and that's correlated to just that continuous side bend. Or men put their wallets in their back pockets. We've heard of that many times before. But those imbalances are causing symptoms in people's bodies.
Okay, I know we have some other pictures of some exercises,
Absolutely.
and let's put those up on the screen, and I'll have you kind of tell me what these exercises are and what they're strengthening. This is called the clamshell.
Yeah, so that's a clamshell. So that's a really important muscle because it strengthens the glute medius muscle. And the glute medius muscle is a muscle that is sort of forgotten with people that work out there, do squats and do hamstring curls. What it does is it strengthens the glute medius, which prevents the knee from collapsing when you're doing a squat. A lot of people, when they're doing squats, you find that their knees will sort of settle in. And this muscle, when it gets stronger, prevents knee injuries, prevents ACL injuries, prevents a plethora of different things that...
and it's the motion of like a clam
Yeah,
shell.
So you're just laying on your side, you're making sure that your knees are bent to about close to 90 degrees, and you're just opening and closing.
What's this one?
This is called the camel stretch or the prayer stretch, and what it is you're basically plopping your elbows onto a chair, and you're allowing your erector spinae muscle, your back muscles, to stretch out, as well as you're stretching out the muscles
your torso,
of the front.
Right?
Yeah, you're stretching your core, you're stretching your torso. It's just a huge, because it basically is reversing that forward head, rounded shoulders, if you look at the picture.
Oh, right, that you were talking about, the back posture. Okay, well, let's look at the next one now. If we could. There we go.
So the next one is just a doorway stretch. So what it is basically it's stretching your pecs. It's also allowing your scapular muscles in the back, the muscles that are in between your shoulder blades, to close in. And what you're doing is you're training those muscles to begin to start opening and closing, which is what they should do on a day-to-day basis. But when you have that forward head, rounded shoulders, it prevents it from happening.
Okay, I believe we have one more. Is that correct? There we go.
Okay, so this one is a prone glute squeeze. So what it is
you're squeezing that block between your feet?
Yep, you're squeezing that. It's a little foam block, or you could use a pillow at home. You're making sure that your torso is completely flattened onto the floor, and you're just squeezing that pillow at the same time contracting your glutes in order to get the glutes to activate and to fire.
All right, Chris Estafanous, thank you so much for coming in. We appreciate it. Physical therapist at Set Sports Physical Therapy, and we'll have you back in, and you can work us out a little bit
absolutely.
more. Okay.
I'd love to.
All right. Thank you so much. We'll be right back.